Well, we're back right here in the studio, and we have with us right now Professor Ralph Defronzo. Professor Ralph is the chair of the Diabetes Division and Professor of Medicine at the University of Texas, San Antonio in the United States. Professor, welcome back to the state of Kuwait, and once again, welcome back to our program, Hala Kuwait.
Great. You know, it's a pleasure to be here. You know, I have now become so familiar with the people in the country, I think you need to make me an honorary citizen of Kuwait.
Well, it's our honor to, and it's a privilege to have you with us. You're a distinguished and world-renowned leader when it comes to the field of diabetes, and thank you for taking time to be with us tonight.
My pleasure.
Thank you, sir.
Yeah.
And now you had a keynote, I believe, address at the Kuwait and Texas collaboration, Groundbreaking Diabetes Update Part 2. Can you tell us, our audience, about your presentation, please, sir?
Yeah, so we had a very, very exciting morning. I gave a presentation, lots of questions. And for the people listening in, the most current data that I have, we're able to get, is that about 25% of adult Kuwaitis have type 2 diabetes. And for every person who has type 2 diabetes, we know there's at least one additional person who is pre-diabetic. So this morning, what we talked about was pre-diabetes, okay? How could we identify the people who are at risk to develop diabetes with the possibility of starting the treatment long before you develop diabetes? So this was very exciting. We actually now have really good tools to identify the people who are at risk, and my goal is, working with the Dasman Diabetes Institute, to try to set up a program here in all of Kuwait, which will allow us to not only diagnose the people who have diabetes who are not known yet to have diabetes, but to even pick up the people before they have diabetes and now start the treatment at that stage.
Good to hear that. And Professor, I have to say, the symposium, we were taking a look at some of the images, provided good turnout, and the people were very interested, very interactive.
Yes, they were. And there were lots of questions. A lot of discussion went on for almost an hour afterwards. But we know that there are certain things. If you're overweight, if you have a family history of diabetes, women who develop diabetes during their pregnancy, the diabetes goes away after they deliver the baby.
Sure.
They're at very high risk. People who have high blood pressure, who have abnormal lipids. So we can get a pretty good handle who's at risk. And what we'd like to do is to identify them, get them into the healthcare system, get them onto a healthy lifestyle, exercise, trim down. We'd all like to be a little bit thinner, and if necessary, actually think about using appropriate medications long before you develop diabetes.
Excellent. So, Professor, can you please give us your impressions about Dasman Diabetes Institute, which was founded by the Kuwait Foundation for the Advancement of Sciences?
Yeah. So clearly, Dasman has done a great job here. I have to say that their clinical facility in terms of patient care is outstanding, really state-of-the-art. And equally, in fact, maybe not even more impressive, is the research that's going on. Cutting-edge research can compete with anywhere in the world, including us in Texas. And in fact, we're doing a lot of collaborative issues, and we're running parallel studies at the Diabetes Institute, Dasman, with San Antonio, Texas. And one of our goals is to compare what does diabetes look like in the United States as here. And we know that there are ethnic differences,
Sure.
there are genetic differences,
Yes.
and we'd like to know what are the differences in the treatments that have been developed and we use in the United States. Are they the appropriate treatments? And can we develop even better treatments for diabetes worldwide?
Professor, keep us up to date on the latest when it comes to the joint collaboration on the research that you may be doing. And you are a world-renowned expert in the diabetes field. And it's an honor to have you right here on our program, Hala Kuwait. Can you please tell our audience what is the latest when it comes to diabetes care and treatment, sir?
Yeah, well, what we've learned is the old drugs, they're still good drugs,
Okay.
but we have newer drugs that are even better. And even interestingly, an old one, pioglitazone, is turning out to be a really good drug. So it turns out that diabetics, they make enough insulin sometimes, but the tissues don't respond to insulin.
Okay.
So we need drugs that improve insulin sensitivity. Pioglitazone is an old drug, and it's very effective, and we need to see more people using it. We also have some breakthrough drugs. So one class of drugs called the SGLT2 inhibitors, they work on the kidney, and what they do is they actually work in a unique way to have the kidney put out the glucose in the urine. And these drugs are lowering your glucose very effectively, but what we've now learned is they protect your kidneys and they protect your heart.
Okay.
And then even more revolutionary, a new class of drugs called the GLP-1 receptor agonist, for abbreviation. But these drugs are very good at saving your beta cells. They're the ones that are making the insulin, and they also have good effects to protect your heart, and believe it or not, they also protect your kidney. So we think that this combination, triple combination therapy of the GLP-1 receptor agonist with pioglitazone and the SGLT2 inhibitors are the way to go. And the studies actually that we've done in the United States have been done in concert here. And I can tell you for the first time in year 2023, the American Diabetes Association guidelines have changed for the first time to now suggest that you should be starting with combination therapy using these drugs that we've developed in combination with work at the Dasman Diabetes Institute. So this is truly groundbreaking information.
Well, that's some great information, Professor, and it's a pleasure to have you with us. I know you've had a very long day. We appreciate your valuable time and insight with us. Is there anything you'd like to close with this evening right here on Hala Kuwait?
Other than I love Kuwait, I plan to continue to work with the Dasman Diabetes Institute, make the ties even stronger, and I really would like that honorary citizenship here as a Kuwaiti citizen.
Well, thank you so much, Professor, and we look forward to seeing you on your next visit for another interview with us. Thank you for coming this evening.
Let's do it sooner rather than later.
Inshallah, as they say. Thank you, Professor. We'd like to thank our distinguished guest, Professor Ralph Defronzo, Chair of the Diabetes Division and Professor of Medicine at the University of Texas, San Antonio in the United States, for his time with us this evening right here on Hala Kuwait. Right now we're going to be moving on to our next report tonight right here on the program, and it's dealing with the April Bazaar. Stay tuned.